Welcome everybody once again to a Safe Place podcast. I'm joined by a special guest today, Natasha Anderson-Foster, who's a psychosexual therapist with over 15 years experience in the sector. So, hello there. How you doing?
Hi.
How's it going, Natasha? All right?
Fine, thank you.
So talk to us about what it is that you do then, Natasha.
Yeah, so I work as a psychosexual therapist. I work within the NHS, but I also run a small private practice that's currently functioning online at the moment.
Okay. And obviously, let's get straight into it then. So obviously, with lockdown and everyone's stress levels going through the roof at the minute, I can only assume that people's sexual health is facing difficulty at the moment. Have you seen an increase in terms of the lockdown and people come to you for help?
Yeah, I've seen an increase in the clients approaching me for psychosexual therapy, for private psychosexual therapy, and I think that's probably more to do with spending a lot more time together and the issues being more heightened.
Yeah. And in terms of helping people, is it easier to see a couple together and work through those sexual issues that may be occurring, or do you get many people coming on their own?
It is easy. It's better to see a couple together because ultimately it is a couple issue, even though the problem lies with one partner. But a lot of the time I do get people come in individually who say that they don't want their partner involved, or even say that my partner is not aware of the issue. And that indicates that they're not talking about the issue.
And that's a big factor there, isn't it?
Yeah, definitely.
So if they're not talking about it, obviously it should be easy to see that it's not going to get resolved. The first thing that's got to be done is them speaking about the issue, isn't it?
It should be, and there is that issue with sexual communication. So often I do a little bit of work around sexual communication before I do any kind of going into treatment planning with a couple. If I find that a couple do need like more intensive relationship therapy, then I'd refer on and say you probably need to spend some time exploring what's going on in your relationship. Rather than working on the sexual issue at this point.
Okay, and what are some of these? I bet there's a whole magnitude of different sexual issues people come and see you for. And what are some of those issues? Yeah,
so we have dysfunction, so physical dysfunctions, and also behavioural issues. So sometimes it will be people will come in and say that they have diagnosed themselves with sex addiction.
Yes.
It's become an issue, especially over the lockdown, that they're using more pornography and masturbation, and they're not happy with that. So that's an issue that comes up quite often. And then also there is the erectile dysfunction, premature ejaculation, fear of sex, vaginismus, unable to be penetrated. So there are a wide range
And Natasha, how is it? I mean, is there a basic foundation from which you work from? So you can see that everyone's got all these different sexual health problems right there. Is there any type of core principles that you follow to try and work with them all on a similar basis? Does that make sense?
Yeah, it does. I think we always do an assessment. So we do have to, I have to assess the relationship, how safe that relationship is, whether there's any domestic violence or emotional violence or any coercive behaviours. And then we also do when it's in regards to a physical sexual dysfunction, we'd want to exclude any kind of medical issues.
Okay, so it's one of the things you look at right there is just excluding the medical issues, and then you can work with them on a psychological basis.
Yeah.
And I would say that in my experience, and I've not got as much experience with you in terms of supporting people going through psychosexual issues, fear or anxiety is usually one of the main things that causes these dysfunctions, isn't it?
Yeah.
What are some of these fears that people have in terms of sex?
For some women, it could be that anticipation of pain. It could be of hearing stories as a youngster about pain, or just hearing subliminal messages about, you know, childbirth or painful sex or something, or, you know, you shouldn't let men go there. Yeah. You know, so that could cause a slight fear. And
that's a great point. I mean, it's incredible to think of all the stories we heard as kids, and we believed them to be true. And obviously, we haven't grown out of that old mentality in a sense, have we? Definitely.
And so for men, there is performance anxiety that, you know, Missy Elliott's song, I don't know, 5 Minute Man.
Yeah.
You know, so there's a lot of pressure. And society today is very sexualized.
Yes.
And performance there's a lot of pressure to perform.
Yeah, society is, as rightly as you say, everything's idealised at the minute and put on a pedestal, and we always want to try and live up to something, and it usually comes from a place of lack of fulfilment within ourselves, doesn't it?
Yeah. And so I find that a lot of the time I'm doing intimacy work with people, and also arousal work, because what I'm finding is that if somebody has a fear of penetration, they're at that time of engaging in sex, they're not engaging in their arousal.
Yes, I've got you. So they're not engaging in their arousal. So through some of that support you give through the therapy, how can you help somebody better gain some sort of sense of their arousal?
Educating and letting them know that your brain is your biggest sexual organ. So in fact, it's not your genitals that are letting you down.
Yeah.
And it's integrating things such as like mindfulness and you know,
being present,
being in the moment, really engaging. And that's the same for men, and that's the same for women. It's the same for everybody.
I've got on this podcast with the mental health aspect of it, we always talk about that no matter what someone's body's doing, no matter how uncomfortable it is, it's actually it's acting perfectly right based on what you're thinking or what you're feeling. So getting people to understand that these sexual issues, or issues that we call them, it's actually normal. Their body's reacting perfectly normal based on what fears and worries and anxieties they have. So talk to us about some of the therapeutic techniques that you go into then.
Okay, so that in itself is a therapeutic technique. I find that positive expectancy. So letting people know that actually this is how your body is coping with your fear. You know, if you are afraid of something, why would you do it? But also that a big element of psychosexual therapy is that educational aspect, where I go through showing people pictures of diagrams of the genitals and go through a educational process rather than a reproductive process. I talk about the arousal process and how that works and what happens inside the body and why these things are happening.
So it's a complete re-education for them in a sense, isn't it? It's helping them mature from these older, younger perspectives of what sex is, and grow into a more aware, educated understanding of what sex is, and being less hard on themselves in a sense. And realising that it's anxiety that they're feeling, that it's not an actual dysfunction in a sense. Because these things that people go through, they're given a word to describe them. They all sound quite more disempowering in a sense, doesn't it?
Yeah, they are. And, you know, these are all labels, aren't they? They are. And at the core, it never really is what they're presenting with. So even when somebody comes, I've got sex addiction, and they're watching pornography every night, and then when I've done an assessment, you really get into it. You know, they have difficulty sleeping. I mean, that's a really basic example. Or there was things going on at a younger age where they were there was a breakdown in communication in the family, and they sought solace in their bedroom. So that's really good that you're observing that, Natasha. So people come to you, as you say, with sex addiction, and most people that haven't been trained or educated on how to support these people would think that that's the problem. And what you find through exploring more is that it isn't the problem. It's more of a symptom of the original problem or trauma or difficult experience that they've gone through, isn't it? So porn addiction, then, that's a big one, isn't it? Especially now with the internet, it's accessible to anybody at any time of any day or night.
and trying to get someone to work through that addiction, because we're talking about psychosexual health here, and actually we've just brought up another difficult aspect of mental health, which is addiction. So you're dealing with two big things at the same time there, aren't you?
Yeah.
How do we work towards helping somebody move beyond that addiction to porn? I know it's a difficult question in a sense, and it's very abstract, but how would we begin to work there?
Yeah, I think we need to understand the role it's playing.
Yeah.
I'm very cautious not to go in and start telling somebody to stop watching pornography straight away.
Yeah.
Particularly if they've been using it like every night for the past 5 years.
Yeah.
There's a function.
Yeah.
And it's a soothing function. And just like with drug and alcohol, people have something to replace their dependency with.
Yeah.
So I really want to find out the function.
Yeah.
Yeah.
So exploring and finding out that function, for instance, somebody who's going through addictive behaviours towards pornography, and they're looking for that escape from some sort of original pain that sits somewhere in the past, isn't it?
Yeah.
Do you find it difficult trying to explore with a client going back into the past? Because as counsellors or therapists, we always get the cliche, oh, you want to speak to me about the past, don't you? So it's always difficult to try and gently navigate that area with them, isn't it? Do you find there's resistance there with some people to want to explore the past, or that they just want to stay with the present issue that's in hand?
I find that the resistance comes when they haven't come for themselves.
Okay.
So if there's this willingness to want, there's this yearning to want to know why, when people are actually ready to do the work for themselves. When people are approaching for this kind of help for their partner, or because they've been shamed into it, that's when I find a bit more of a resistance.
Okay, so that's a great point. So ultimately, when there's, and it usually comes from suffering, they've suffered enough, they realise that this area of their life is creating that much suffering now. It's natural for any organism, human being, to want to reach out for help or support. When they come to you from that place, you see probably the greatest benefits with the psychosexual therapy. And if they're coming to you for the wrong reasons, not really for themselves or to try and change for somebody else or to change somebody else, it doesn't really work out, does it?
No, we know. Yeah. And we know.
So tell us what you do with the, what's involved with the NHS side of things for you then?
Okay. So, well, exactly this, actually, from a biopsychosexual model. So we take in to consideration the biological aspects, the social aspects, and the psychological aspects.
And there's a lot to take on there, isn't there?
That's a lot. So, I work with in a multidisciplinary team with psychosexual consultants and other psychotherapists and psychosexual therapists as well. Yeah.
Okay. And with all these clients and working in the NHS as well, as it's stressful it is at the moment, how is it that you keep yourself okay? Because it's difficult, isn't it? Because we take on, as therapists ourselves, we can take on a lot of people's worries, stresses, anxieties. How do you keep yourself sane? Which is, it's a hard thing to do in this day and age, isn't it?
Yeah. Well, I love music.
Yeah,
I love listening to music. I love retreating into my family.
Oh, good.
As well.
And the good news is hearing you, because you've got that education, you're better equipped to keep yourself in a comfortable state than one could argue other people that haven't educated themselves in a certain way. Does that make sense?
Yeah. I think that it's a time right now where a lot of people are doing a lot more self exploration. You overhear the word self-care.
Yeah.
Lots of people are doing that. I also burn lots of sage.
Yeah.
So, and do yoga as well.
And it all helps keep your sense of body and mind in a state of balance.
Very much so. Yeah.
So then, just to end it then, it's been a lovely discussion. And let's keep it on the idea of education.
Yeah.
Because they all do sex education in schools. And I'm not aware of how much better or worse it's got since I was a kid.
Yeah.
How much more would young kids benefit from having somebody like yourself with a good, strong education, understanding sexual health, going to a school and letting young people know about their bodies, their minds, and how to deal with the anxieties that come with issues around sex? Because kids are having sex younger and younger these days, aren't they?
They are. I think it would be really beneficial for young people. I was having this discussion recently, and, you know, one of the questions that I often ask is, are you enjoying sex?
Yeah.
Are you aroused? And that is like a magic question for a lot of young people. There is so much pressure to perform, and also seeing that people are getting hold of things such as like Viagra, like young men who don't need to be taking like a Viagra.
No, it's such a shame, isn't it, really?
And, you know, what's that going to do?
Yeah.
So, I think this would be really beneficial in terms of some kind of sexual empowerment.
Yeah.
Just knowing what the body wants, knowing how to say no, knowing how to say yes, and knowing how to tell people what you want.
That's lovely. Thank you very much for coming here today, Natasha. It's been beautiful. And we'll put a description to all the ways people can contact you for your own private therapy at the bottom of the video, all right?
Thank you.
Thank you very much.
Thanks.
Okay.